In this video, I set the record straight on the Social Security payment cap being discussed all over the news because almost everything you've heard about it is completely wrong. Coming up next on Holy Schmidt.
Holy Schmidt!
If you've been on social media or reading the news lately, you've probably seen some version of this story. A $50,000 per year cap on Social Security for singles, $100,000 if you're married filing jointly. It's a big headline with strong opinions, and the rhetoric around it has taken on a life of its own. And most of the articles either miss the point or they're getting the facts flat out wrong. So I'm going to slow this down a bit, and let's look at what this actually is, where it actually came from, and importantly, what the fine print actually says, because what this paper actually says may surprise you. First, let me say I completely understand why this story is confusing, maybe even a little bit scary. A headline capping Social Security benefits sounds alarming, especially if you've spent decades paying into the system and you're counting on those benefits in retirement. But here's what's happening. A thought leadership white paper published by a Washington think tank got picked up by the media, stripped almost entirely of all context, and it's being passed around until it barely resembles what it actually was. By the time it reached most people, it felt like a government announcement was imminent. It isn't, not even close. So let's start at the beginning with who actually wrote this, what their job is, and what this document really is. The document comes from an organization called the Committee for a Responsible Federal Budget, the CRFB. They've been around since 1981. They're nonpartisan, and their board includes former heads of Congressional Budget Office, the Office of Management and Budget, and both the House and Senate budget committees. These are serious, experienced people. The CRFB's mission is to influence policy that keeps the federal budget government's finances going. Things like the deficit, the national debt, and programs like Social Security, Medicare, etc. Those issues have been at the center of their work for decades. And here's the important thing to understand about what they actually do. Their job is not to write legislation. Their job is to write white papers, model policies, publish analysis, and get ideas into the conversation so that when Congress eventually needs to act, there's a well-developed menu of options already sitting there. Think of them as the people who write the menu. Congress decides what to order. And they've been writing that menu for 45 years. In 45 years, the CRFB has published hundreds of white papers, reports, analyses, and policy briefs. They've launched major initiatives like Fix the National Debt, the SSDI Solutions Initiative, and the Trust Fund Solutions Initiative that produced this very paper. They testify before Congress, they get cited by journalists every day, and they are genuinely influential in the conversation. But here's the most important part. Very few of their specific proposals have become law as written. Their biggest effort, a major bipartisan plan to fix the federal budget released in 2010 called Simpson-Bowles, didn't even get the 14 votes it needed to pass within its own commission. Congress never voted on it. It went nowhere as a bill. And the CFRB acknowledged this themselves. In their 2025 review, they wrote, lawmakers have largely failed to address the nation's most pressing fiscal challenge, meaning Social Security, Medicare, and Medicaid. After years of publishing, lobbying, and advocating, the needle on reforming these big programs has barely moved. Now here's the fair counterpoint, because there is one. The ideas in Simpson-Bowles didn't die. They shaped the debt ceiling negotiations in 2011, the fiscal cliff discussions in 2012, and the vocabulary that both parties used years afterwards. Some smaller pieces of those proposals eventually did become law, and they were folded into other legislation over time. The CRFB themselves noted that commission ideas often become laws years later, in pieces, in ways that are hard to trace back to the original paper. So the candid assessment is this. The CRFB is very good at starting conversations and laying groundwork that real deals eventually get built on. They are not very good at turning their own white papers directly into the law. That's not a criticism, that's their actual role. And it's exactly the role that the new white paper is playing. Which brings me to something the CRFB says explicitly in this document, and it's the single most important sentence for understanding what this paper actually is. They write, and I quote, "The Committee for a Responsible Federal Budget does not endorse any particular solution to improve the financial health of Social Security. The $100,000 limit presented in this paper should be added to the library of potential actions, potential options, lawmakers consider when putting together a bigger fix. A library of options, that's what it is. Not a proposal that's headed to vote, not a policy being put in place, a thought leadership paper designed to do exactly what it's already done, and that is to get people talking about the idea and put it in the room so that Congress has something to consider. The question worth asking is not, is this going to happen? The more useful question is, what does the fact that extremely serious and powerful people publishing papers like this tell us about where Social Security reform is eventually heading? That is the question that actually matters for your retirement planning. Before we get into what the $100,000 limit actually says and what the history of Social Security reform tells us about where this is all heading, I want to take a moment to talk about something you can actually control today. Because here's the thing. Washington is going to take its time figuring out Social Security. History tells us that very clearly. But your Medicare plan is a retirement cost that has nothing to do with that debate. It doesn't wait for Congress. It's costing you money right now, and most people are paying more than they need to pay. That's why we're proud to partner with Chapter. They're the only national Medicare advisor that compares and recommends every plan, Original Medicare, Medicare Supplements, Medicare Advantage, Part D, everything. They help people save an average of $1,100 per year on healthcare costs. One member named Jill said her advisor showed her options she didn't even see on Medicare.gov, and their support is completely free. If you're receiving Medicare, or you soon will be, give Chapter a call at 440-703-1224. It's free, it's quick, and most people wish they had called sooner. Okay, so what does the $100,000 limit actually mean? What does it say? Well, here's the plain language version. The CRFB is modeling a combined Social Security income of $100,000 per year per couple, or $50,000 per year for someone who's single. And that number is based on Social Security at full retirement age. So who does this actually affect today? According to the CRFB's own analysis, the cap would affect basically no one. The top 0.05% of couples, maybe they'd have to have a net worth of $65 million, income of $2.5 million a year, and a tiny sliver of their overall income would be Social Security. And basically the reduction would amount to less than 1% of everything they bring home. To put a real number on it, a maximum earning couple retiring at full retirement age collects an estimated $99,600 in combined annual benefits in 2026. So the cap barely touches even the highest earners. The CRFB is clear that only a tiny fraction of retirees are anywhere near these levels right now. And according to their own modeling, the maximum benefit for a couple has roughly doubled since 1990, and it's projected to double again by 2070, reaching $200,000 for the highest earners. The white paper is trying to get ahead of that growth before it makes the funding problem harder to solve. And here's what it would accomplish on its own. It would close about 1/5 of Social Security's 75-year funding gap and save between $100 billion and $190 billion over 10 years. Meaningful, but not a fix by itself. If the Social Security Trust Fund runs out of money, projected around 2032-2033, benefits get automatically cut by roughly 24% across the board, every recipient, every income level. That's not a proposal, that's the current law. The $100,000 limit is designed in part to help prevent that scenario by slowing down the growth of payments at the very top so the funding lasts a little longer. Now let's talk about what's been done in the past, because we've been here before and history is a good teacher. In the early 1980s, Social Security was months away from running out of money. Not years, months. The trust fund was projected to run dry as early as August 1983. Reagan formed a bipartisan commission. It deadlocked, missed deadlines. It looked like a complete failure. Then behind the scenes, a small bipartisan group formed, and they negotiated privately. And they compromised. And in April 1983, Reagan signed the fix just months before system failure. But it wasn't painless. Taxes went up. Benefits became taxable. And the retirement age quietly moved up from 65 to 67 over the next few decades. But the lesson is simple. Congress acts when it has no choice, usually not before. Today, the trust fund is projected to run out around 2032. That's about 6 years away, which means we are not in the crisis phase yet. We're in the conversation phase. White papers, proposals, headlines, that's where this fits in. So what should you do? First, read past the headlines. Read the articles. Read reputable sources. Second, know your numbers. And third, focus on what you can control today. Now, gang, here's the bottom line. This is a serious paper from serious people, but it is not law. It is not imminent. And the version you're seeing online is missing context more than likely. The real story is this. There's a funding problem. Washington knows it. And history says they will act, but only when they need to act. Your job is to plan accordingly. Know what you have, know what you can control, and don't let headlines make your decisions for you. If you like this video, check out that video. Here are the things you can now do at age 65. And if you have Medicare questions, don't forget to call our partner chapter, 440-703-1224. This is Jeff Schmidt, and I will see you in that video right there.